Hey, I'm Dr. Michael Tebbe with Bright Star Chiropractic.
I'm Dr. Sydney Curls from Dr. Curls for the Girls.
Yeah. So Dr. Curls is a pelvic floor PT. And, this is an area that most of us never really think about, because it's down in the bottom of our pelvis and we can't look there. I don't touch there very often.
Right.
And, but it's really important. So she's going to tell us a lot more about it because I'm going to learn some stuff too.
Wonderful. Okay, so I brought my model here, and this is a female pelvis. So just keep that in mind. Do know that males also have pelvic floors. They look a little bit differently. They're oriented a little bit differently, but they do have pelvic floors, and they're very important. And we'll talk about that a little bit later. But on the female pelvis, what we see here in the front, so I'll show you too.
Yeah.
So this is going to be what we consider layer 1 of the pelvic floor. Layer 1 of the pelvic floor is going to include the ischial cavernosus, the superficial transverse perineal muscle, the external anal sphincter, and the bulbospongiosis. We also have a deep transverse perineal muscle that's in layer 2, but just know that layer 1 is going to be this like triangle, vaginal sphincter, and then anal sphincter. We go to layer 2. This model doesn't show it super well, but just imagine with me.
Okay.
Layer 2, I like to call your P control muscles. Okay. So if we look here, so this is the urethral opening. So you do have an external urethral sphincter. You also have a compressor urethrae. And then females have a sphincter urethrovaginalis that goes around the urethral sphincter and also around the vaginal opening.
Okay, so how many sphincters are there for the female?
So we have our urethral sphincter, we have our vaginal opening,
okay,
and then we have the anal sphincter.
All right.
So the second layer mostly controls the urethral sphincter. You have a lot of muscles that help with that, with urinary control and voiding. But then you also have a muscle that's specific to females where it's the sphincter urethrovaginalis. So it goes around the urethra and around the vaginal opening.
Okay.
Yeah. So that's layer 2. And remember, I know it's a lot of muscles. Remember, there's also that deep transverse perineal muscle that runs right behind the superficial one. So that's just going to help support the perineal body, which when we're pregnant, when we're postpartum, it's a hot topic because we don't want to tear, or we have torn when we had a baby. That muscle is often involved.
Transverse.
The superficial and deep transverse perineal muscles. Yes, they are often involved. Most commonly. Okay, so then we talk about layer 3.
Yeah, I can hold that.
Okay, thank you. We'll talk about layer 3. So before we get there, I want to take out the organs. So you can see that is layer 3. It's the bottom of the pelvis, essentially. It's what's called the pelvic floor. It looks like a little pelvic bowl. This is not empty in real life. We have these organs in here. So just to kind of orient you, this is how everything looks.
Yeah.
Okay. So this is the rectum with the anal sphincter. This is the vagina going to the vaginal opening, connected to the uterus, the fallopian tubes. This is the bladder that is connected to the urethral opening.
Yeah.
Okay. So this is how it's situated. So when we think about something like a prolapse, when you see something protruding into the vaginal canal, it's not actually the bladder or actually the rectum. It's the bladder or rectum pushing on the vaginal wall. Because you see how it's oriented. So if you're laying down, the bladder would be on top, rectum on the bottom.
So when you're doing an exam, you can feel the bladder pushing. Okay.
Yes, you can feel, you can see it when you have somebody bear down and sitting, lying down, or standing. Oftentimes, the more gravity dependent you are, so when you stand, the more severe it's going to appear or feel. And if somebody is symptomatic when they're standing, that's a great way to examine and see what's going on. Okay. So that's the muscle.
So these are women typically, which is pretty common, like if they laugh, cough, jump, they're going to have some leaking.
Yes, there can be leaking, there can be pressure.
Yeah.
Even if you don't see it, if you feel pressure when you do those things, or when you hold your baby, or when you push your baby, or you try to work out, that can be indicative of a prolapse as well.
Okay.
Yes. Can I hold? Can I
Yeah.
give you these two? Sorry, I'm giving you all the things. Okay, let's go through these muscles. Okay, so we have here puborectalis. So think pubic bone to rectum.
Okay.
Okay, it slings around the rectum. This is very important in voiding. So if anybody's constipated or having hemorrhoids when they're pregnant or postpartum, this muscle is often implicated. And
in terms of like, it's not
releasing.
So it's too tight.
It's too tight. Yes. So when you look at it in like a diagram, you'll see that it literally slings around the rectum, and it's supposed to let go to allow the rectum to get into voiding position. And if it doesn't, then it's really hard.
Yeah.
So that's often a really quick way to help with having hard bowel movements. That muscle shares fibers with the pubococcygeus. So that it's like right there.
Yeah.
Pubic bone to coccyx.
Yeah.
Okay.
Tailbone.
Tailbone. Yes. Yes. Then we go to iliococcygeus. Ilium to coccyx. They named these really easy. So you know what's happening. Yeah, it's great. And then something that's really important is the obturator internus.
Okay. Which is like a hip muscle.
Yes, it is a hip muscle. You can access it vaginally. Right here.
All right.
Yes. So this is not a pelvic floor muscle, but it's often implied in pelvic floor dysfunction.
Because it's tight?
It's very tight. There is weakness. There is incoordination. It can affect the pelvic floor and vice versa. So you can also, if you look right here, so that's on either side, it goes through to here.
Okay.
So that can also just give you more information if somebody's having like pain when they're sitting, if they're having really deep hip pain that's like radiating to their butt and it's not like just like where you would think normal hip pain would be. It could be that obturator secondary to a pelvic floor dysfunction. Does that make sense?
Yeah.
Okay, great.
So then when you're checking for that, like the obturator, you may do like a hip range of motion exam. Look for asymmetry or differences side to side.
Absolutely, yes.
And then you'll resistant like test to see if it's strong or weak.
Absolutely.
And it's usually weak.
It's
and
almost,
tight.
Almost always, yes. And we also will check and palpate and see how it responds. So we'll look at it externally, right next to that ischial tuberosity. We'll also look at it internally, vaginally, and see if that is recreating symptoms for people. Does that make sense?
Yeah.
And then the last one I want to talk about, the last pelvic floor muscle, is the coccygeus. So that's the coccygeus right there.
Yeah.
Right behind it is the sacrospinous ligament. So this is a very big tailbone pain culprit. So if somebody's like, I cannot sit down after childbirth, like oftentimes they have like a whiplash injury of the tailbone, basically like the tailbone extended really fast with like a fast delivery, or sometimes there are tailbone fractures, things. Yes. So this muscle is often, and ligament obviously are really, really tight. And there's a lot of work that we can do outside of just like your normal breathing and exercises, but like manual work to help facilitate the release and help that rehab. Okay.
And they call it the sacrospinous because here's the sacrum and then it's the spine of the ilium, right?
Yeah, exactly.
Different than spine.
Yes.
Different than the sacrotuberous ligament.
Exactly.
Got it.
Yeah.
Okay.
Yeah. So that was a very long intro, but I just wanted to make sure y'all knew and could see.
No, and I wanted us to do this video because, we have a lot of mutual clients, pregnant women, postpartum, and just talking to some of the pregnant women, it's like, I'm like, had you really ever thought about your pelvic floor prior to pregnancy? They're like, no, not at all. So it's just good to be aware of this stuff because I know you do work with women to help prepare for childbirth, and I think a lot of it's, I don't know exactly, but it's centered around, bringing awareness to the pelvic floor, learning to control it again, like relax it or flex it.
Exactly.
And I know you and I have talked about this before. the classic way of thinking about the pelvic floor is that it was just weak and you need to strengthen it. And she's rolling her eyes. And the new way of thinking about it is you got to learn to relax it and see what is causing it to be tight.
Exactly. Yes. Almost always there is a component of learning to relax that is like more important than anything. Because if you're too tight, you have no range of motion, and our bodies need range of motion.
Yeah.
The next thing I would say is control. Being able to use the pelvic floor as it should be used as part of a system and not just by itself. That's why we absolutely hate Kegels, because that is not functional. The pelvic floor is part of the core system. Your core is on and doing things all throughout the day, all throughout your movements to varying degrees, and it coordinates with the rest of your body to support you, support your posture, support your movement. The pelvic floor should be doing the same thing. So you have to train that.
Okay. And part of training that, which we talked about, is like learning to breathe properly.
Learning to breathe properly and making sure that the pelvic floor has the support that it needs. Okay. So if your obturator internus is super weak, the pelvic floor is not going to relax and do its job appropriately. If your glute med is super weak and you're a runner, your pelvic floor is not going to respond well to that high impact because it doesn't have the support of the glute med when you're in a single leg position on that single leg landing.
Yeah. Okay. What kind of symptoms should women pay attention to? I think we covered some of it, but anything with laughing, coughing, any kind of leakages there, that can be an indication.
Absolutely. So any kind of leaking, it can be urine, feces, gas.
Okay.
That is a symptom of pelvic floor dysfunction. On the other hand, hesitancy, constipation, not fully emptying, that's also a symptom of pelvic floor dysfunction.
Okay.
Any kind of painful intercourse or arousal or orgasm or not having an orgasm or difficulty achieving orgasm is a symptom. Pain, pelvic pain, low back pain, persistent hip pain, tailbone pain, all the pains.
That's a lot of stuff.
Yeah. A lot of stuff, yeah. And then honestly, feeling pressure and just feeling like you have a very deep weakness. Like you can't do certain things because you feel like your body won't support it. That's often.
Yeah. Yeah. You just have a sense that you can't jump.
Yeah, exactly.
It would just be bad. So stuff's going to fall out of you.
Yeah.
That's how women have said it to me.
Yes. And I mean, I have people that they're postpartum and they're like, I asked them to do something and they're like, my brain won't even let me try it. Like that's a symptom of like, okay, then your deep stability system is compromised because you should be able to like turn those on.
Yeah. And your brain knows that and it's protecting itself, protecting you.
Exactly.
Okay. So how about for men? Like what kinds of stuff could show up from pelvic floor dysfunction? And I think with guys, it's typically probably the same thing. It's like too tight.
Yes. A lot of times it's way too tight. Really, all the things I said before apply. Yeah. But then I would even add in for guys, testicular pain is a huge one. Difficulty achieving or maintaining an erection is a really big one. And then just if you have a history of prostate issues, that can also indicate that you're probably going to have some pelvic floor issues. So like if you have to have your prostate removed or it's enlarged, because it does act as a second sphincter. So then you can have dribbling after or just put on complete incontinence because your body relied on that enlarged prostate and now it's gone. And now you have to just retrain the muscles to or not even supplement, but to do their job. But they
to work.
Yes.
Okay.
Yes.
And usually, I think with men or women, maybe there could be certain posture patterns that you'll see that are pretty common, indicative.
Yes. If somebody has a tight pelvic floor, a lot of times I see them having a super flexed and like flat pelvis.
So like kind of like that.
Yes, exactly. Because
you guys, if you pay attention, start looking at how people stand and walk, and you'll see that because we sit a lot.
Yeah, that's exactly it. We sit all the time, And when you do that, when you tilt like that, and this is a very like stiff model, so it's not going to really show.
Yeah.
But you're effectively shortening the pelvic floor because you're
Got it.
making the tailbone get closer to the pubic bone.
Uh-huh.
So you're basically walking around like this in your pelvis.
Got it. Okay. So you're doing this inside your pelvis.
Exactly, which is like not great because it's already crowded in there. Why would you make for less room and less movement?
Okay.
Mm-hmm.
And then I guess too, like they might have just difficulty raising knees.
Absolutely, deep hip weaknesses
And
are huge.
Tight hips as well.
Tight hips. Yep.
Yeah.
Yep. Tight hips. Honestly, I'll say if we're talking about guys in particular, one of the biggest things outside of testicular pain, is going to be constipation.
Okay.
Constipation and having to pee all the time.
All right.
Mm-hmm.
Makes sense.
Mm-hmm.
Same reasons.
Mm-hmm.
Okay.
Mm-hmm.
So yeah, we're going to show some exercises in a minute to kind of talk about just the intro to how we can start bringing awareness to the pelvic floor.
Absolutely.
I don't know. I mean, do you ever have people just kind of put their awareness in the area besides breathing, or?
Yeah, honestly, not besides breathing. Breathing is really
in addition
important.
to,
Yeah. In addition to it, I have them learn to mobilize their spine.
Okay.
That is huge because we sit all the time. We have bad posture. We're often really weak in our backs. So we get really stiff. And that stiffness contributes to the pelvic floor not moving well because you actually need good flexion and extension in the pelvis. So teaching them how to mobilize and release their tailbone. So we'll go into that too. Yeah.
That's why it's been such a pleasure getting to know her and like working together with people. It's like our work goes together so hand in hand.
Oh, it's great.
It's like she's helping me do my job better, and it helps me. I can help you get faster results with people.
Oh my gosh. Yes. My clients that see Dr. Tebbe as well do phenomenal.
Yeah.
They do really well.
It makes it easier for you.
It makes it so much easier.
It's great. Yeah. Likewise. Yeah.
Thank you.
Definitely.
It's great. It's great synergy, honestly. Like
the
two disciplines go hand in hand.
Definitely.
Very complementary. So.
Okay. All right. So on the next video, we'll start showing some breathing stuff to help bring awareness to your pelvic floor.
Perfect.
All right.